paralyzed, or rather you're not feeling from your waist down, but you're awake so that they can tell you what you need to do. Now the surgery bed, it's like one of those old movies, you know, in the 1930s when they first started doing surgery. It's like a dark room, it's a dark green room, windows are up there, many boxes, you know, boxes of spare parts or what, but there's so many different boxes. And there's about 8 or 7 people in the operating theater with you. So there's a small table and you have to fit on that table because I guess there's no room for you to move around. So I was put on my right side because they were operating on my left hip. And when they do that, they actually take this thing that sort of fixes you in place. So it's like, I don't know if you've done any woodwork. There's something you do to hold the wood in place. There's some machine that they use. So they had put it on my back and in my tummy to hold me in place so that I don't move around, because it is actually a bit of a violent surgery. So they block you. I couldn't see what was happening, but I could see some machines that they were using. Now, one of the machines, I asked the doctor, what is this thing? And he says, that's an electric saw. So it's very hard to break a bone. And that electric saw is what they use to actually cut your femur. And then they take the implant and jam it into the femur. And at some point, there was a lot of pulling happening, and you could hear, it literally sounds like in a garage. You could just hear kong, 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 and you know that they're making space in your pelvic bone to put a screw in there and then put the implant. So the whole surgery took about 4 hours. I was very happy because I think they put me on morphine, and I was just being quite jovial and asking the doctors what exactly was happening at each step.